Femoral acetabular impingement and hip labral tears seem to be increasingly troublesome for people of all ages. And if you're one of the unlucky few diagnosed with either or both of these conditions, you may be wondering why you developed these conditions in the first place. While there's not a single cause of FAI and labral tears that can be applied to everyone, there are a few consistent factors we know contribute to these conditions. Understanding why you developed FAI and labral tears is an important first step in figuring out what you need to do in order to reverse these painful conditions. In this video, I'm going to help you understand what could have caused your FAI and labral tears, and what you need to do in order to reverse the pain and discomfort that comes with it. It's important to remember the substantial evidence supporting the fact that even with a diagnosis of FAI and labral tears based on imaging, it's possible for you to live your life without symptoms. This requires you to understand what potentially caused your issues and work backwards to restore the proper mobility, flexibility, and/or strength needed to live pain-free. One of the major factors the research addresses is high-impact activities starting at a young age, especially when rotational demands on the hip are involved. Activities such as soccer or football fall into this category, among other sports children partake in. This doesn't mean children should not play these sports, as there also seems to be a genetic component in the development of FAI. Rather, coaches and parents should be mindful of their children's complaints of pain or discomfort and address them as soon as possible. Regardless, if this factor applies to you, restoring both the mobility and strength of hip internal and external rotation is going to be important. Posterior hip capsule stretches at multiple pain-free angles of rotation should be incorporated into your therapeutic exercise routine, as well as clamshell variations and 90-90 hip mobility exercises. Another factor that is correlated with the development of FAI is an anterior pelvic tilt. This occurs when the pelvis is tipped forward and is common in dancers, gymnasts, and martial artists, in addition to other activities that encourage an extended posture. Even if you have never participated in these activities, anterior pelvic tilt is a common result of prolonged sitting, which decreases abdominal stabilization and glute strength and encourages spinal extension and compensations and stability by the hip flexors. Regardless of the cause, decreasing anterior pelvic tilt can have a significant effect on reducing the symptoms from FAI and labral tears. I made a video with the 3 best exercises for correcting anterior pelvic tilt, which I will link in the description below. But strengthening the deep abdominals, hamstrings, and glutes, and stretching the hip flexor muscles will be important for you if you suspect that you have an anterior pelvic tilt. Ultimately, there are many factors that contribute to the development of FAI that, unfortunately, you're not going to be able to change. Genetics and pathological hip conditions in early age have also been shown to correlate with development of FAI, but it's not feasible or possible to change these factors. However, the exercises I mentioned in this video to improve hip rotation and decrease anterior pelvic tilt still have the potential to decrease the symptoms of FAI and labral tears. Understanding what may have caused your FAI to develop is crucial in determining what you need to do in order to reverse the symptoms. If you're looking for a structured program proven to decrease the pain from FAI and labral tears in only 4 weeks, check out Pain to Perform FAI and Labral Tears, link in the description below. And you can download my free ebook, 8 Solutions to Modern Day Musculoskeletal Pain, by going to paintopeak.com/ebook, link in the description below. And please like and subscribe so I know to make more videos just like this one. Thanks for watching.